This video is the continued part of dermatophytosis. In this video, we'll be discussing morphology and cultural characteristics of dermatophytes, pathogenesis and pathogenicity of the disease, and diagnosis, treatment, prevention aspect of the dermatophytosis. A proper timestamp has been given in the description, so make use of that. In the previous two videos, we have discussed regarding the introduction, history, habitat, etiology or pathogens of the dermatophytosis. So we'll continue the topic of dermatophytosis. Here in this video, we'll discuss the morphology of the dermatophytes. Basically, when it comes to the dermatophytes, they may present as non-parasitic phase and parasitic phase. When the fungus is present in the culture, or that is in vitro culture, so in such condition, the dermatophyte is as a non-parasitic dermatophyte. If it is present inside the tissues, such as nail, hair, or any other keratinized tissue, so such type of fungus is called as parasitic phase fungus. So first we'll look at the morphology of the non-parasitic dermatophyte, then we'll look at the parasitic phase dermatophyte morphology. In the non-parasitic phase of dermatophyte, when it comes to morphology, so we can look at the production of septate and branching hypha, and these are together called as mycelium. And also the dermatophyte in the non-parasitic phase will produce asexual spores, and mainly the spore produced from the dermatophytes are conidia. So they are basically found on the aerial mycelium. Again, based on the size and the presence of cell composition, the spores are classified as macroconidia and microconidia. As the name itself indicates, macroconidia is large and multicellular thick-walled spore, whereas microconidia is small and unicellular in structure. So, as these microconidia and macroconidia are very important diagnostic value when it comes to the diagnosis of the dermatophytosis. So in general, dermatophytes such as microsporum and prycophyton usually produce a particular conidial spores. So basically, it is generally and largely noticed that microsporum dermatophytes are mainly produce macroconidia, whereas prycophyton dermatophytes will produce the microconidia. So this will help in the diagnosis of the disease dermatophytosis and the species of the dermatophytes. Now, there are many different hyphal varieties will be produced from the dermatophytes. They may be a spiral, nodular, racket, and many other different shapes are there. So this can also be a diagnostic tool when it comes to the diagnosis and differentiation of the dermatophytosis. And also, the colonies of the dermatophyte will show a different pigmentation. So they may be a buff, white, or yellowish in color. And this is about the non-parasitic phase of the dermatophyte. Now we'll discuss regarding the morphology of the parasitic phase. As we already discussed, the parasitic phase dermatophyte is nothing but which is an infective unit and which is there presence in the host tissues which has got infected. So basically, it is also produce a different set of spores, and these spores are also asexual spores, as conidia, macroconidia, and microconidia. These two are also asexual spores. Again, in the parasitic phase, we'll see a different set of spores which is produced from the dermatophytes. A very important spore which is produced in the parasitic phase of the dermatophytes is arthroconidia, which is also known as arthrospore. So basically, this is produced from the fragmentation of the hypha. So this fragmentation of the hypha will lead to the production of arthrospores, and these spores will be present in the keratinized tissues such as hair, skin, nails, and they remain viable for many years inside the tissues. And another type of spore which is produced in the parasitic phase of the dermatophyte is chlamydoconidia. So whenever there is absence of conidia, so in such case, chlamydoconidia will also help us to diagnose the dermatophytes and dermatophytosis disease. And another very important peculiar thing with respect to the parasitic phase of dermatophyte is, in parasitic phase, the sexual spores, mainly ascospores, are not at all present. So this is a key point you should remember with respect to your examinations. So when it comes to some of the today's what we have discussed in this video, basically macroconidia is produced from the dermatophyte microsporum, whereas microconidia is from prycophyton. And arthroconidia are there in the tissues and they are infective unit. And there is no ascospores, nothing but the sexual spores in the parasitic phase of the dermatophyte. and hyphal peculiarities such as spiral racket shaped hyphal varieties can also help in the diagnosis of the dermatophytes and the dermatophytosis disease. Now let us look at the cultural characteristics of the dermatophytes. Basically, cultural characteristics of any fungus is usually depends on the common media which were used and any selective agents which were added to the media to promote the growth of a desired fungus and to inhibit the undesired, and also what are the growth characteristics of a concerned fungus, and if there is any diagnostic features are there can be very helpful to diagnose a particular fungus. So when it comes to the common media which were used for the diagnosis of dermatophytes, and they are Seborrheic dextrose agar and dermatophyte medium. This DTM is a specialized modified version of Seborrheic dextrose agar. As this media contain agar and the percentage of the agar is 2%, and it also contain a proteinaceous source for the growth of fungus, and that is 1% peptone, and it also has a 4% glucose, therefore this is called as dextrose agar. And initially the pH of this agar is mildly acidic, thereby it will inhibit the growth of bacteria and which favors the growth of fungal. Now when we look at the dermatophyte test medium, it is a specialized medium for dermatophytes, where the medium contain a pH indicator, that is phenol red. Whenever the media contain phenol red, with the growth of fungus or with the growth of dermatophyte, the media will turn towards red, giving indication that the growth of the culture contain the fungus dermatophyte. To make it more elaborate, basically the DTM, the media is acidic media, where initially in the acidic media the dermatophytes fungus will grow, and initially this media is in yellowish color, and it also contain a pH indicator in the media, and that is a phenol red. Whenever in the acidic medium the dermatophytes will get their growth, and that increased growth of dermatophytes in the media will digest the present proteinaceous source, that is peptone or any other proteins like keratin in the media, will increase the production of ammonia. This ammonia turns the acidic media towards basic or alkaline side. As the pH of the media tends to increase, the color of the media also shifts towards the red side from initial yellow color of the media. So this can be visualized in this image, as here you can notice the background looks like yellowish colored, that is a dermatophyte test medium, and these buffy whitish colonies are of the dermatophytes colony. When the growth of dermatophytes colony is taking place, with surrounding these colony, the media color shifts from yellow to reddish tinge, and that shift of reddish tinge will indicate that the colony is of dermatophyte. And the basic reason behind why this yellowish color turns to red color is the media contain a pH indicator, that is phenol red, and basically the initial color of this pH indicator is yellowish color, which gives to the media. Whenever the dermatophytes digest protein, and this protein will produce, during this digestion of the protein, the dermatophytes will produce ammonia. This ammonia tends to increase the pH of the media, where this led to the change of the color from yellowish to reddish around the colonies of the dermatophytes. So this is about the dermatophyte test medium. Now in the medium itself, one can selectively add some of the agents such as cyclohexamide. So basically this will inhibit the saprophytic fungi. The saprophytic fungi are such fungi which mainly or largely depend on the carbohydrate source for their nutrition rather than the proteinaceous source for the nutrition. So thereby the saprophytic fungi can be inhibited by the adding a cyclohexamide selective agent in the media. And also we can use the antibiotics such as gentamicin, tetracycline, chloramphenicol to suppress any other bacterial contaminations in the media. And when it comes to the growth characteristics of the dermatophytes, they are aerobes, they require oxygen for the growth, and they are non-fermenters. They don't ferment sugars, whereas the saprophytic fungi will ferment sugar. And they are proteolytic, They degrade keratin and protein for their nutrition. During this process only, they produce ammonia, which tends to change the color of the media towards reddish by increasing the pH of the media and giving it alkaline media. And the optimum temperature for their growth is 25 to 30 degrees Celsius, and there is incubation days, and this incubation period ranges between days to weeks for colonies to grow. And these are the cultural characteristics of the dermatophytes in the media. Now, there are other diagnostic tools are employed to differentiate or diagnose dermatophyte, specifically for Microsporum canis. Here, the technique is called Wood's lamp technique. Here, the UV light of 355 nanometer wavelength will be used. So, in this technique, whenever the dermatophytes are exposed to the UV light, so they fluorescence green color in the hair or skin. So this fluorescence of green color is because of the presence of a metabolite called tryptophan. The tryptophan will give green fluorescence, and this is very specific for a fungus called Microsporum canis. Apart from this, any other dermatophyte won't show the Wood's lamp diagnostic technique. And another important feature for this technique where the fluorescence is only seen in infected tissues, and this is not seen in the culture. So basically, to sum up this part of the cultural characteristics of the dermatophytes, the media which we used to culture the dermatophytes are Severus dextrose agar and dermatophyte test medium. The pH which is favored for the growth of dermatophytes is mildly acidic, that is 5.6. At the same time, this acidic pH tends to inhibit the multiplication of the bacteria, thereby making it bacteriostatic. And some selective agents such as cyclohexamide will be used, and the cyclohexamide will inhibit the saprophytic fungus growth. And there can add antibiotics to inhibit bacteria. And in the Wood's lamp technique, a green fluorescence is produced by the Microsporum canis fungus, and this is very specific for this fungus only. And the growth is very slow, and it happens between 1 to 3 weeks at 25 to 30 degrees Celsius. A very key important thing one should know with respect to saprophytes and dermatophytes is that dermatophyte test medium is usually employed to differentiate selectively for dermatophytes from saprophytes. The principle behind this is that saprophytes tends to use carbohydrate as their source for nutrition. During this process, this inhibit the conversion of acidic pH from acidic pH to the alkaline pH, because saprophytes won't digest protein, thereby there will be no production of the ammonia. They only digest carbohydrate, therefore there is no increased production of ammonia, and there is no turning of pH from acidic to alkaline. So this is how dermatophytes are differentiated from saprophytes. Dermatophytes are basically use proteinaceous source for their nutrition. In that process, during the digestion of the keratin or any other protein, they tends to produce ammonia. This ammonia will turn the pH of the media from acidic to alkaline, giving changing of the color of the media from yellowish to red. So this is why the saprophytes and dermatophytes are important to know. So this is about the cultural and other diagnostic features for dermatophytes. Now we will discuss regarding the pathogenesis of dermatophytosis. Before having a detailed discussion on pathogenesis, one should have understanding with respect to the structure of hair. The structure of hair involves outer cuticle and inner medulla, and in between the medulla and cuticle there is a presence of cortex. So the pathogenesis will be having a discussion in 5 points, as how these dermatophytes will take entry into the tissues of the body, and then how this evolutional mechanism has provided an adaptation to keratin protein, and what are the virulence factors which are responsible for the pathogenesis, and how these dermatophytes will colonize the tissues, and what is the effect of dermatophytes on hair of the body. So as you all know, the dermatophytes will produce different sexual spores, and among them a main spore which is produced from the dermatophytes is conidia. Again, this conidia, based on their size and number of cells which are present in the spores, they are classified as macroconidia and microconidia. These spores will get entry through a small abrasions or wounds on the skin. So a very important feature of the dermatophytes is that their capacity to adapt to the keratin protein. So basically dermatophytes are called as keratinophilic. So this is due to their affinity towards the keratin rich tissues of the body, such as skin, hair, nails, horn and feathers. So these dermatophytes are largely remain restricted to keratinized tissues of the body. The reason for this is abundance presence of keratin in those areas and the lack of iron which is there in those areas. The another important thing with respect to lack of iron is that the iron in the body is present in general deep inside the tissues. So basically in the blood circulation, which is in the form of bound form of iron, they are usually having a complex with proteins such as ferritin and transferritin. So to access iron from this protein bound ion bound protein is very difficult for dermatophytes, so they have to compete with the host defense mechanism such as the rich blood supply and the immune cells which are there in the deep inside the tissues and iron bounding proteins. So it makes difficult for dermatophytes to access iron in the deep inside the body. So which made the dermatophytes to adapt for such areas where there is a poor source of iron is there, and also there is a rich presence of keratin protein is there. So this has made the dermatophytes to adapt for keratin protein. Now we'll look at what are the virulence factors which are responsible for the production of pathogenesis in the dermatophytosis. And mainly keratinase is the enzyme which is responsible, and this keratinase enzyme is nothing but this is one of the proteolytic enzyme, one of the main proteolytic enzyme which is present in the dermatophytes, and other enzymes such as collagenase and elastase are there, but majority of the role is played by this keratinase enzyme. This keratinase will dissolve the keratin, so allowing the fungus to grow and survive in the area earlier where keratin is filled in the tissues. And there are some species specificity is also noticed with the extraction of keratin. So when it comes to Microsporum nanum, a dermatophyte in fig which act only on the keratin of certain animals, that is Microsporum nanum dermatophyte will only act on the keratin of the pig. So some species have shown this host species specificity. Now we'll have a discussion about how these dermatophytes will colonize the tissues. Basically, at the spore, these start germinate in the stratum corneum, and the stratum corneum is the outermost layer of epidermis. So as the spore germinates, as this starts germinate, it starts producing hyphas. So and these hyphas they will produce arthroconidias, and they are another type of sexual spores which are mainly present in the parasitic phase of the dermatophytes. So in the previous sections of this video where we have discussed that the dermatophyte has a parasitic phase and non-parasitic phase. In the parasitic phase, main form of sexual spore which was produced is arthroconidia, and in the non-parasitic phase it will be seen as a morphology, a hypha, and some different spores are there produced. But in parasitic phase of dermatophyte, a major sexual spore which is produced is arthroconidia. So this will be produced from the hypha which is evolved from the spores germination. So we'll again in the end we'll discuss how the hair invasion from these dermatophytes will be occurring in the tissues. So basically the structure, the clinical lesion which is caused by the dermatophytes is called as ringworm lesion. Here in the invasion of the hair, the spores will germinate near a follicular orifice, and actually there are different types or ways through which a dermatophyte will invade hair. So and those are as endothrix and ectothrix. So we'll discuss this with the example. Follicular orifice is a gap between the hair follicle and the skin. So what happens means whenever a spore of the dermatophyte germinate near the follicular orifice, it take entry into the shaft of the hair. So in the shaft of the hair, it start producing the hyphas, and again through these hyphas there will be production of spores. So in a type of invasion where only spores are present inside the shaft without breaking the cuticle. So only these spores will be involved in the shaft of the hair. Such type of invasion is called as endothrix. What eventually happens means these spores will accumulate, and this tends to make weakening of the hair, and eventually it will cut off and fall. So this is endothrix way of invasion. And another way of invasion of hair is that, so as consider suppose this is the follicular orifice where this spore will start germinates. Again, as the same as in the endothrix, it will enter the shaft of the hair. Till then it is both same in exothrix and endothrix. Now it starts breaking the cuticles. As these cuticles are fragile, so these cuticles will break, and in the outside the cuticle or on the shaft, they start producing spores. So here the spores will be produced on the surface of the hair, making rough hairs. So eventually they will be weakening and they will be fall off. So this is about the two different methods of invasion of hair. One is the endothrix, where the spores are produced in the shaft. So you can observe in this image as this structure is hair cortex, and this outer side is cuticle, and the inner thing is medulla. So these are the different multiple spores which are produced inside the shaft of the hair, so making endothrix way of invasion. So here also you can notice the top one is ectothrix, where the spores are produced uh, on the outer surface of the hair. So this is the ectothrix. But in this ectothrix of invasion, this cuticle is very fragile and it breaks out, and on this structure, these spores will be produced. But in case of endothrix, the cuticle is strong and which is not fragile, and which eventually it will won't break. So that leads to the production of spores inside the shaft only. So therefore again the pressure buildups and the hair will cut up and fall. So this is about the ectothrix and endothrix way of hair invasion. So this is that only. The spore germinate near follicular orifice, then hypha penetrate the hair follicle and dissolve the keratin in the cortex, and as it makes a space for the growth of hypha and the production of spores, that is conidia. So which makes the weakening of the hair breaks easily. Then there are two types of hair invasion. One is endothrix, where arthroconidia forms inside the hair shaft, hair cuticle remain intact. But in case of ectothrix, arthroconidia form outside the hair shaft, where cuticle is destroyed. So this is about the pathogenesis of dermatophytosis. Now here we will study the different symptoms and the characteristic lesions of dermatophytosis. Symptoms of dermatophytosis involve: the disease as such is not fatal, but it may cause severe economic and zoonotic risk involved. The first sign always involved with the loss of hair, that is alopecia at the site of infection, and which is followed by the skin inflammation causing erythema, scaling, and crusting of the lesion. And the risk factors of this disease are young animals, old animals, sick and stable animals, rather than those animals which are on pasture. And also another factor is the ringworm is mainly noticed in winter season. The hallmark lesion in this dermatophytosis is hyperkeratosis. So whenever the keratinase infect and it start degrading keratin of the tissues, the host defense mechanism activate. So in return or in turn, the host defense mechanism will start producing increased amount of keratin. So that increased keratin will start depositing, so that will leading to the increased keratin around the infected area. So that particular lesion is called as hyperkeratosis. So this is basically occur in the layer of stratum corneum, which is the outermost layer of epidermis. So wherever the hairs will invaded, so they will become weak shaft, and eventually they will break and leading to the circular scaly patches. Till now we already discussed these are things, so giving a ring like a lesion called as ringworm. And there are a range of reactions will be there, ranging between the mild erythema to the formation of vesicles. Then they will become increase in size to called as pustules. Then there will be secondary bacterial infection leading to the formation of pus involved. So those lesions are called as suppuration. And there are also carrions are noticed. So these are local flake-like lesions, sometimes look like a nodule or a tumor-like growth will be noticed, specifically in case of dogs which are affected with microsporum canis. And it also shows inflammatory responses, may stop fungi, but the thing is that the affected host are prone to the secondary bacterial infection is noticed. So these are the symptoms which are expressed by the animal. And here are some of the sites on the species where particular animal will experience. So in case of dog and cat, the lesions are specifically restricted to head and extremities. In cattle, head, neck is very common. And in case of horse and sheep, the lesions are restricted to neck and girth region. And in case of poultry, the majority of the lesions are located at the comb and wattles. So they're giving a specific term called as fall favus. This favus is nothing but a form of ringworm infection on the head, that is nothing but on the wattle, which is very chronic and which is very severe in condition. So such cases are referred as favus. So this occurring in the fowl, so it is called as a fowl favus, or sometimes it is also called as white comb because of the white crest lesions were noticed on the comb of the bird. So it is called as white comb disease. So now lesion characteristics involve hypha will invade stratum corneum, giving rise to hyperkeratosis. That is the defense host defense mechanism will start producing increased keratin, leading to the hyperkeratosis, and the lesion will spread centrifugally. The lesion will spread centrifugally, giving a ring-like region, and the active edge will be very active where infection is spreading, and inside the center it is the region of healing. So whenever somebody wants to take a sample for the culture, so it is better to go for the edge of the lesion rather than collecting sample from the center. So the another factor why these dermatophytes won't invade deeply into the tissues is because their growth will be supported whenever there is a temperature ranging between 20 to 25 degrees Celsius. Sometimes it may extend to 30 also. But as the tissue goes deeper inside, where the temperature of the body is increasing, so the growth of the dermatophytes are not favorable at 37 degrees Celsius. So these dermatophytes tends to infect the superficial tissues of the body, and sometimes there is hypersensitivity reactions are also noticed, and these reactions ranging between the they will be immediate to delayed response of the hypersensitivity. So when it comes to humans, the specific terms are given for this lesion, so, which is caused by these dermatophytes, and they are tinea barbae. This is the lesion of the ringworm in beards, and captis is the involvement of ringworm in scalp region, that is in the head, and tinea corporis all over the body, and tinea cruris in the region of groin, and in tinea favosa it is also in the region of scalp. But the thing is that whenever this favus involved, it has become a chronic infection, and it is more severe case. And in case of tinea imbricata or manum, the lesions are noticed on hand, and in case of padis, so the lesions are on the foot, and in tinea anguinum, so lesions are inside the nails. So through these images you can get an get to know these lesions, how these looks. So here you can differentiate it with the other form of the ringworm. So this is tinea pedis, where the lesions are noticed in the foot region, and you can also see the hyperkeratosis, increased secretion of the keratin in defense mechanism from the host body, and here also the lingworm region. So you can evidently see the alopecia and circular lesions extending centrifugally, and here also the lesion is circular, you can evidently observe it, and this is also the same case with alopecia, circular lesions. So this is also the same. Yeah, this is the case of a bird where this comb and vitals will become white crusty patches will be noticed. So therefore these things are called as favus lesion. So this favus is nothing but the severe chronic infection of ringworm. This is called favus, and this is the infection of tinea favosa. So here one can observe the scalp region has become more severe infection of the dermatophytes, and leading to chronic infection. So this is about the lesion of tinea favosa, and here this is in the beard region, that is tinea barbae, and this lesion is tinea capitis. So the tinea capitis and tinea favosa, they are different when it comes to the severity of the infection. The tinea favosa involve more chronic and more severe form of the tinea capitis. So this is also the fall favus, and this is the tinea cruris, where in the groin region the lesions will be there, and this is of infection in the nail, that is anguinum, and here is a clear round lingworm like region which is extending centrifugally, and edge or periphery of the lesion is active, whereas the center part is healing. So this is about all the symptoms and lesions of the dermatophytosis, and these structures you can see evidently. Even in case of horse also you can observe these lesions on the neck and face area. So this is about the symptoms and lesions of the dermatophytes. Thank you. Now we'll have a discussion on diagnosis of dermatophytosis. There are several different methods are employed to diagnose dermatophytosis. In the direct examination, a test is employed, and the name of the test is Wood-Slam test. In the Wood-Slam test, UV light is used, and which is of 365 nanometer wavelength. Whenever this UV light is projected on tissue of the body which is infected with the dermatophytosis, if specifically dermatophytes such as Microsporum canis or Microsporum adoni are there, so from such tissues, a bright green fluorescence will be emitted. So this will be indication that the dermatophytes are invaded the tissues. So this is not fully reliable, and this is only a result is seen in 50 to 70% of the cases only. So here, this is the lamp. This is named based on the scientist Robert William Woods. This lamp basically has a filter which used to block visible light, and which will only allow UV light to be projected on the tissues, which is a subject of diagnosis for the dermatophytes. So this technique should be performed in the darker room, so there should not be any visible light. So it will be leading to the false result of the test. So basically, the Woods lamp technique involves a Woods lamp which has a filter. The filter used to block the visible light, and which only allow the UV light. Thereby, the projected tissues emit the bright green fluorescence. So here you can see the fluorescence which is emitted from the dermatophyte infection sites. So this is the a cat with the dermatophytosis showing Fagio result for the fluorescence. So this is about the direct examination of dermatophytosis. Now, when it comes to microscopy, specimens are collected from the skin scraping, and the specimen should be collected from the margins of the lesion, and sometimes the hairs are also plucked, and those skin lesion and hairs are prepared with the 10 to 20% KOH or NOH with gentle heating will leads to dissolve of the keratin, and this is subject to microscopy. In the findings, hairs may be seen as increased in thickness. So this is because of it, the hairs are encased with the arthroconidial spores. So in such condition, hairs will be seen as double in thickness, and the skin's scraping involves, it may show the branching septa hypha will be there, or sometimes chains of arthroconidial spores can also be visible in the microscopy. Now, through culture, one can diagnose the dermatophytosis. A media such as dermatophyte test medium, so basically which contain phenol red, is a pH indicator, which usually turns to red due to the alkaline byproducts which is produced from the digestion of the protein which is there inside the media. And another culture media which is commonly used for dermatophytes is Severus dextrose agar. These agar can be employed with the antibiotics to inhibit the growth of other bacteria to specifically cultivate the desired fungus. And incubation period for this dermatophytes is it may goes up to 4 weeks under 25 to 30 degrees Celsius, and specifically for trichophyte and verrucosum, the temperature of incubation is more, that is 37 degrees Celsius, and in the culture the colony will appear like hyaline fluffy colony. So these things are the colony features in the culture. So this dermatophytosis has to be differentiated with insect bites, urticaria, some bacterial pyoderma, seborrheic dermatitis, and interdigital dermatitis. So one should have clarity when it comes to the diagnosis of dermatophytosis. So often the chances are very high that the one tends to misdiagnose the disease, maybe as the insect bite, urticaria, bacterial pyoderma, and like so. So these are some important tips for exams. Fluorescence test is used specifically for Microsporum canis or Microsporum adoni, but it is not specific, and also it will not give a 100% result in all the cases, and it is also not for all species. And dermatophyte test medium will turn red. This is because of the tendency of dermatophytes to metabolize protein, therefore production of ammonia. Ammonia tends to turn the pH of the dermatophyte test medium from acidic to alkaline. So in such condition, the yellowish color of the media will turn towards red in the alkaline nature or alkaline condition of the media. The alkaline condition is because of the higher production of ammonia, which is from the metabolized protein. And whenever someone wants to go with the microscopy, so in such condition the a skin scraping sample should be collected from the edge of the lesion. So because the active fungal growth is noticed on the edge of the lesion only. So this is about the diagnosis of dermatophytosis. Now we have reached the last topic of the dermatophytosis, that is the treatment and prevention of the dermatophytosis. In the mild cases of the dermatophytosis, the treatment might not require any intervention from the drugs, because in the mild cases the disease itself is usually self-limiting, so it may regress in weeks to months. If there is any secondary bacterial infection is there, or any compromised host such as young, old or immune suppressed animals are there, so in such condition the fungal disease may persist. So now when it comes to the systemic therapy, the drug griseofulvin is widely used, especially in the small animals. The oral route is preferred. So this griseofulvin will be deposits in the keratin, which makes skin, hair, nails resistant to the keratinase enzyme. Now the fungus will shed with dead keratin, so therefore the prolonged therapy will be needed if somebody is using griseofulvin. The side effect with the griseofulvin is it has a negative impact on the GI tract, and it is hepatotoxic and also teratogenic. And other choice of drugs involves the azoles such as ketoconazole, fluconazole and itraconazole can be used. They are an alternate systemic antifungals, but the problem is they are very expensive and they also have some hepatotoxic risk. So if there is a griseofulvin resistant, or the griseofulvin is contraindicated, in such cases one can go with the azoles. A very good option is available. And when it comes to topical therapy, the products containing salicylic acid, benzoic acid, iodine, nitamycin, so imidazole derivatives such as clotrimazole, miconazole, so dips will be available for cattle and horses. The thing is that this topical therapy will not work for the if there is any infection is invaded in the nails. Now when it comes to the prevention, hygiene is the key factor, and screening with the Woods lamp for the cats and dogs such as reservoirs. So this Woods lamp technique will be very helpful to prevent this disease. And when it comes to the vaccine, especially for cattle against trichophyton verrucosum, a vaccine has been developed which gives protection for 3 to 5 years, but there is no effective vaccines are yet available for microsporum species or any other trichophyton apart from trichophyton verrucosum. So some of the pointers of this topic are: drug of choice for small animal is griseofulvin, which will be deposited in the keratin. So these things will be used as a systemic antifungal. And for large animals, the topical aniclozoles dips are very effective. And only successful dermatophyte vaccine is developed for trichophyton verrucosum in cattle. So this is about the treatment and prevention of the dermatophytosis. Thank you.